Food insecurity in Mississippi is an ongoing crisis. Attempts to mitigate this issue have been made by several different people and organizations to help those in need. Catherine Montgomery is the Director of Strategic Impact and Data Analytics at Mississippi Food Network. She's been working there for about 15 years and will share the impact that Mississippi Food Network's food bank has on food insecure areas.
The Mississippi Food Network, we are the only Feeding America affiliated food bank in the state of Mississippi. We service 56 central counties in the central part of Mississippi. And as the only food bank in the state of Mississippi, we provide food to over 400 partner organizations that supply the food to their communities. On average, we're serving roughly 160,000 individuals each and every single month, which equates to almost 2 million people served each year. So unfortunately, the food insecurity rates in the state of Mississippi are extremely high. According to Feeding America's Map the Meal Gap, almost 20% of individuals in our state are food insecure. That's over 500,000 individuals in the state of Mississippi that don't know when and where their next meal is coming from. These are due to a variety of issues, systemic issues, poverty-related issues, living in food deserts, and just basic needs going unmet as a result, which often includes food. Get involved, I think, is a great way to help alleviate food insecurity rates in our state, or food insecurity in our state. First and foremost, host a food drive. Donate those pounds of food and those meals to a local food pantry, a local soup kitchen, or even the food bank here in Jackson, Mississippi. Other ways to get involved: volunteer. We have a great volunteer program here at the food bank where we partner with organizations, individuals, and corporations to come into the food bank packing senior boxes or backpack meal kits for kids, or food pantry boxes that go out to our local food pantries and throughout our 56 county service area. So transportation in Mississippi has always been a barrier. And public transportation in rural areas and rural communities is very lacking and limited. A few of our food pantries do offer delivery assistance for their meals, but a lot of our partners that we have don't offer that additional service. But we know that a lot of organizations do allow others to pick up on an individual's behalf. And then one of our programs that we have is a mobile pantry program. And with that program, we do a drive-through distribution, and individuals that come to that distribution for food assistance are eligible to pick up additional product for if they have a neighbor or a mom or a senior on their street and in their neighborhood that is in need, but may not have access to the pantry as a result of limited transportation. So we try to do the best we can, but unfortunately with limited access to transportation, it's been a barrier, and we try to remedy that by having additional partners in more low-income areas and food deserts, but we can't solve it all, unfortunately.
In Utica, Mississippi, Hubbard's Food Mart is a local gas station that serves residents. Kayla Smith is a cook at Hubbard's and has been working there for 11 years.
I've worked at this store about 11 years. We mean a lot to the community, actually, because at one point we were the only gas station in Utica, and also for funerals, we are like the main source of catering for a lot of community events that go on. Because it is a small town, a lot of our residents not able to go to the larger cities, which some of them like 10, 12 miles away. So I feel like by us just being closer to them and having exactly what they need so they don't have to go out of town, I think that's important to them. Some challenges we face trying to stock fresh food is the suppliers. By the time they get it to us, sometimes it's ruined, so we have to pick through it, so we don't have as much to offer to the community after we pick through what's, good and what's not. But we do have a local supplier who comes on every Saturday to bring us fresh fruits and vegetables. Being a main source of food here, we just make what they like. And so a lot of people like those quick options, so a lot of times it's the fried food options. The price compared to larger chains, I would say it is a little more expensive because of the way that we receive it. Like we have to buy it from somebody, and it's not very many places around here for them to get it from. So that kind of makes the price go up just a little bit, but it makes it more available. We do not accept SNAP benefits right now. The only difference was they did sell a lot more grocery items when they did accept SNAP. Being a main source of food for the community of Utica, I do kind of feel pressured because sometimes I do think to myself, we are, providing a lot of fried food to the community, but I feel like the healthier options can sometimes be more expensive to get. Like I was saying, these options are cheaper and they buy it. So I do feel like it's a big sense of pressure to provide better options because it's harder to get those materials to provide them.
Dr. Whitney Herring is a pediatrician who specializes in obesity medicine. She will share her insight on the effects of unhealthy foods on the body.
In my experience, the poor health outcomes relate more from nutritional choices. Now, that's not always a child's fault. Obviously, parents play a role in that in providing, but it has many facets, including what's available at school and then secondarily sedentary habits. I do think that the rise of fast food establishments has led to abandonment of healthier options, mostly because a lot of those fast food restaurants don't provide many healthy options, and sometimes it is less expensive to eat at a fast food restaurant and feed a larger number of people in the family versus making healthy choices in terms of fresh fruits and vegetables. I do think that geographical influences do matter in terms of healthy food options, particularly with food deserts, meaning places where people have to drive at least 30 minutes to access healthy food choices, and then sometimes even those places that they are able to access don't have the healthy food options. I do think that rising food prices for healthy foods like fruits and vegetables will affect those in rural areas, but I do also think that it will affect people in urban areas because food deserts exist in urban areas as well. Unfortunately, someone in a rural area would have to pay more in gas money trying to reach those healthier items. So, total expenditure to not only access those foods, but then spend it, probably would matter a little bit more for a rural person, but it would affect urban areas as well. The question of what should be done to mitigate factors in food desert areas, it's kind of the million-dollar question because there has been a lot of research done in trying to increase knowledge in both growing foods, trying to grow fresh fruits and vegetables, and then trying to teach how to cook those items. Those studies have happened, but there has been kind of a lack of sustainability starting from the very beginning. Even when a mom is pregnant, teaching her how to eat healthy, prepare foods, and then generationally kind of changing the dynamic there, I think would hopefully help. But that's going to take years and years and decades.
Mark Jones is the Chief Communications Officer for the Mississippi Department of Human Services. Based out of Jackson, MDHS provides the citizens of Mississippi with resources to access food stamps and social services.
SNAP benefits stand for Supplemental Nutrition Assistance Program, and SNAP benefits are administered through the United States Department of Agriculture Food and Nutrition Service. It is the nation's largest food safety network. And what that means is it provides to 370,000 Mississippians access to nutritious food through an EBT card. Benefits are loaded each month, and it's meant for those who are at or below 130% of the federal poverty level, and can also be eligibility is determined by household composition within those federal poverty guidelines. For the last month of 2025, December, there were 170,000 cases involving 360,000 Mississippians. utilizing SNAP benefits across the state of Mississippi. The Mississippi Department of Human Services has sought a waiver for a SNAP food demonstration project from the United States Department of Agriculture Food and Nutrition Service for implementation of a 3-year test on the banning of sweet, sugary beverages, candy bars and chips, carbonated beverages, to see what those benefits for health outcomes, limiting obesity, minimizing hospitalizations due to obesity and high blood sugar and diabetes. And so we want to test this. Highly rural areas, low socioeconomic development, has a high percentage of the population that utilize SNAP benefits. For addressing the issue with nutrition, SNAP's essential in those impoverished areas. These benefits support individuals in regards to their nutrition and their overall health outcomes. And that is why SNAP is important, and utilization of SNAP in those communities drives their economy, and it also drives their health outcomes.
Debbie Upchurch coordinates and runs the first Ridgeland Food Pantry. She shared with us the profound impacts food donations have on the community.
We serve about 125 families that come to our parking lot every week, and then there are about 10 more additional families that we serve that do not come to our parking lot. We started our food pantry in 2020. We had been, as a church, a small group of us went to Mission Arlington in Texas, and we served with them, giving out food, giving out clothes, just praying with people in their pantry. And it was just something I thought, what if we brought this to Mississippi? And then I thought, well, do we have anything in the Ridgeland area? And I checked around. I really didn't see very many food pantries, so we just decided, we prayed about it, and we decided we would start one here at our church. And the cool thing was that we only had a closet to start this whole ministry, and we never dreamed how it would multiply, but we just took a little spot, started it, and then God has just really grown it to an amazing ministry. Because we serve these 135 families, that translates into sometimes over 1,200 people by the time it extends out to their family and friends. A lot of our clients are senior citizens who are caring for grandchildren. So even though there are 125 cars there, it really expands to a broader scope. And we serve people from over 8 counties, so it really is a central Mississippi food pantry. I feel like it has a huge impact. It's not meant to feed them solely because it's not enough food, but it is food that can help them make it each month. We've had several challenges with our pantries. It started out mainly as people over 50 serving here who are retired. And sometimes the loads are very heavy. So we reached out to businesses, and we've had businesses come in to serve with us. So sometimes we have needed a business partner to serve with us once a month for about an hour and a half. And then sometimes a new need that we have would be a bilingual person, someone that could speak Spanish, because we do have a good clientele of people who do speak Spanish, and most of us are not fluent in Spanish. That's probably one of our biggest needs. It takes a lot of people to make this work every week. We have business partners that come in and help us separate the food that we get. But it really starts in the morning. We have security people that are here on campus to help make sure everything is safe. We have people here to help people know where to park so that they can get their food. We have people who are packaging food, dry goods. We have people that are packaging fresh fruits and vegetables. We have people in the parking lot who are praying with these clients. And we also have to gather some personal information because we have to keep a record of their information to turn into Mississippi Food Network so we can continue to partner with them. And I love the fact that Madison Central donates to Mississippi Food Network because this is where this is one of the places where your donations are going.
While progress has been made, food insecurity in Mississippi continues. Through donating, raising awareness, and volunteering, citizens can ensure that no one in their community will go to bed hungry. This has been Amy Page with JNN.